everyone, and welcome to our second episode of AHIMA's High Five Policy Podcast for 2026. I'm Lauren Riplinger, Chief Public Policy and Impact Officer for AHIMA. And as many of our regular listeners know, this podcast is all about how we're trying to keep you up to date with the latest policy issues that are happening and impacting the health information profession and the health IT community, both in Washington, D.C. and beyond. I'm excited because joining us today is Dave Cella, AHIMA's new CEO. Dave, thanks for joining us today.
Oh, thanks so much for having me.
Absolutely. I'd love to kick off and just ask you the question of tell us a little bit about yourself and your background for listeners that may not be familiar with your background.
Sure, happy to do it. So first off, born and raised in Massachusetts. So today's a little bit of a somber day for us here in New England. It's the day after the Super Bowl. But born and raised, went to school at UMass Amherst out in the western part of the state and studied economics, resource economics. Little fun fact, you may know this, Lauren, but I actually met my wife there second week freshman year of college. And so been together ever since, happy to say. Again, studied economics and did a couple of things at first after graduating, but eventually found my way into academic publishing. And that really started what's become sort of a through line through my career, where I've spent most of it primarily working for organizations that are generating high value, high quality content and information, either for professionals or students or faculty. So started off working for an academic publishing company, moved into higher education. That's when I really started focusing more on healthcare. And in 2004, and I believe you may know this, I think you're familiar with the company, but I worked for HC Pro, 2004, 2005. And that really started my focus on healthcare. Then I ended up going back to my prior organization with a great opportunity, and that was really to build out their allied health program, which I did. And so that was really in higher education. And so progressed on, eventually took over other disciplines like health administration, public health, nursing, medicine, eventually became vice president and executive publisher for their entire higher education portfolio, which included some disciplines outside of healthcare. But eventually, 2018, that's when I was reunited with HC Pro, and I joined at the time their parent organization, Simplify Compliance, as their chief product officer, and just had a tremendous experience there. Learned a lot, worked for some great leaders, and had some great colleagues. And it was at the end of 2022 that the owners of that company decided that HC Pro was ready to be sold. And so early 2023 started that process. That's when I was asked to step into the president role for HC Pro and help lead that sales process. And as I've said a few times, absolutely thrilled when I learned that AHIMA was the ultimate buyer or acquirer for HC Pro. And so joined the AHIMA family in September of 2023. And as you know, I had the good fortune of sitting on the executive team at AHIMA for the past couple of years and learned a tremendous amount. I still have certainly a lot more to learn, but that was just a tremendous experience for me to be able to be part of that executive team and learn much more about AHIMA during that time period. And so then when the opportunity came for me to step into this position, again, I'm coming up on 90 days, not quite there yet, and happy to say I remain as excited and optimistic as I was, the day I found out I was getting the position. So that's just a little bit about my career. Again, always been sort of on the product or content side of things, and again, really focused on just delivering that high quality, need to know information for professionals and students. And then finally, just back on the personal side, should mention, as mentioned, my wife at UMass Amherst, with three wonderful kids. I have a son and two daughters. The son is a senior in college, middle daughter's a sophomore in college, and then our youngest is a freshman in high school. So still keeping us pretty busy here. But again, just thrilled to now be in this position and working with you and the others at AHIMA.
Absolutely. And we are equally thrilled to have you as our leader. And it's really been a pleasure for me working with you on the executive team, particularly and having advocacy conversations, which I know hasn't necessarily been a natural part of HC Pro in the past as well.
Right.
So I'm curious to ask, particularly given that you've been part of the AHIMA family for a couple years now, from your perspective, why is it so important that associations like AHIMA are engaged in advocacy work in Washington, D.C.?
Yeah, no, that's a great question. I think, in kind of simplest terms, I view advocacy as really one of the most important ways that AHIMA can sort of activate or amplify, the voices of health information professionals and our members. And I view our members and other HI professionals as, the subject matter experts, right? They're the ones dealing with health information day in and day out. They understand better than anyone the real positive impact that ensuring accurate, protected information that's interoperable, can have on healthcare in general, and specifically on ultimately patient outcomes. And so, the ability to kind of amplify the voices of health information professionals, so that they can help guide, policy and legislative decisions. That to me is crucial for AHIMA. And so, actually, in addition to that, and you're aware of this, as an executive team, we've been working on looking at our strategic plan and updating it, and just kind of refocusing it a bit. And in doing that work, we've identified, what I'm calling four strategic imperatives, and advocacy is one of those four. And so I just view it as such a critical way for us to push forward the issues and topics that we know can have such a positive impact on healthcare.
Absolutely, totally agree. And as you know too, AHIMA offers a number of different opportunities for our members to really engage in advocacy throughout the year. I think one of our kind of tentpole things that we do is our annual advocacy summit, which is coming up in March in Washington, D.C. We've talked a little bit about why it's important at an association level for entities like AHIMA is important to engage in advocacy. But when we kind of take a level down and look at it from the professional's perspective, why is it important for your average health information professional to engage in advocacy work?
Yeah, I think about this a couple of different ways. I mean, first, I'll go back to that kind of that notion of amplification, right? So certainly we all know there's strength in numbers, and so the more involvement that we can have from health information professionals and our members, the more potential impact can be made. And I think getting that level of engagement from each individual out there, that really helps us raise awareness, across multiple key stakeholder groups, that then helps in our efforts, right? And just helps with the efficacy of our efforts. And so, but all of that is dependent upon that individual engagement. And so it is critically important for health professionals to become involved in that regard. But the other side of this, way I look at it is, I do think, certainly by having individuals become engaged, as I mentioned before, they are the experts. It adds, weight and validity, credibility to what we're trying to push forward. Um, and and I think in addition to that, I'm trying to think how to best put this. It really helps us at AHIMA. I've witnessed when I was at the Advocacy Summit, for example, last year. You can kind of see the positivity and the excitement and the energy that comes from individuals becoming involved. And it's sort of that notion of, rising tide floats all boats. You kind of, and I kind of, the other way I think about this is I sort of picture this, call it a virtuous circle, right? So you have individuals become more engaged and involved. They generate that positivity and excitement, which then gets reflected from us internally as staff. And I think it helps us put even greater emphasis on the important things. And that in turn generates more productivity, which then gets others excited, right? So it kind of creates this virtuous circle, and it just benefits all of us. I think it just makes us all better when people get involved. And I've even just from my attendance last year, just seeing, quite frankly, in certain circumstances, joy from those being involved. I think a certain level of satisfaction of I'm doing the right thing here, and I'm working towards positive change. So yeah, I just think there's a lot of benefit from it.
And it's interesting you say that because as I contemplated, I will say that I think that coming out of Advocacy Summit, particularly at a staff level, there's tremendous amount of energy that comes off of that because we see the excitement in so many of our members, conversations we're having in the hallway, on Capitol Hill, et cetera, all that stuff. And again, that chance to make an impact
Yeah,
for the profession is incredibly powerful.
absolutely. Yeah.
So obviously, healthcare is undergoing rapid transformation, and there's going to be some headwinds that is facing this profession in the next 5 to 10 years. How do you see policy as a tool to help mitigate some of those challenges that we might be seeing in this environment?
Yeah. So when I think about that, I kind of, sort of see a couple of things converging at once here. There's certainly there, and this has been the case for a while now, but kind of this exponential growth in just the amount of data and information being generated. And then so at the same time, you see this sort of proliferation of tools and solutions being developed to handle and manage that data and to, automate workflows, hopefully create some efficiency. And so as these two kind of forces come together, I think there's going to be an even greater need to ensure that that we have good data governance and that the data is accurate and protected, secure and interoperable. And so as all this happens, again, there's going to be a need for additional guidance to ensure the proper use of those tools and additional technology as it changes, and doing that while still encouraging innovation, right? And so I think health information professionals are best suited to inform policymakers on what those guidelines or guardrails should be, without creating too much excessive barriers, right? You still want to encourage that innovation, but ultimately want to make sure that those guidelines are in place. And so that's going to be a critical part, I think, of health information professionals' roles moving forward.
Absolutely, totally agree. Dave, I'd love to ask you this last question, and that is, what aspects of advocacy or public policy excites you the most in your new role as CEO of AHIMA?
Yeah, well, you mentioned this earlier. It's not something that was really a part of what certainly HC Pro in the last 7 years of what I've been doing. Not part of what HC Pro was doing. And if I think about being kind of selfish here for a second and think about my career and what I've done, certainly a lot of effort went into helping individual students, faculty and teachers, and then certain professionals. And even when you think about HC Pro, how it started, right? It was individual subscriptions to a newsletter and then evolved from there. And I'd say over the past 10, 12 years, HC Pro has really evolved into doing more at the organization level. So the products and solutions that they've generated now are going more towards the a department rather than an individual, and multiple departments. And in some cases, we've had engagements with multiple hospitals within a health system offering these solutions. And so that's been exciting because you see the ability to reach more people and help more people. And so as I think about advocacy, and what excites me about it, to me, it's taking that additional step, right? It's scale, and it's that ability to positively impact even more people, and also maybe a bit different from before, to have that lasting effect as well. And so to me, again, it's exciting, one, because it's new for me and I love learning new things, but it's that, right? It's that scalability, it's that ability to impact even greater numbers of people. And again, as we all work towards what I think at the end of the day, even when you think about AHIMA's mission, underlying it all, ultimately for me, the hope is that we are going to help improve, patient outcomes at the end of the day. And so there's a lot that has to happen in order to get there. And advocacy, I think, is a critical piece. And it's exciting for me to think about that potential impact.
Wonderful. Well said, Dave. Well, Dave, we appreciate so much that you spent time chatting with us today. For folks that are interested in checking out additional episodes of our High Five Policy podcast, you can find us on Apple, Spotify, and YouTube. Thanks, Dave. We appreciate the time.
Thanks, Lauren.